Every year, millions of people over 60 walk into clinics and hospitals for routine scans, stress tests, and screenings. It feels responsible, smart even. Catch issues early, stay ahead of problems, right? But here's the catch. Not every test is harmless, and not every result is helpful. In fact, some tests, if done too often or without proper caution, can quietly trigger complications. Like a sudden stroke. This video isn't here to scare you. It's here to empower you, to help you ask the right questions, to help you protect yourself and those you love before walking into that exam room. Today, we'll uncover 5 common medical tests that, while well-intentioned, can carry silent risks for seniors. And more importantly, you'll learn exactly how to safeguard your body and your peace of mind. And don't worry, I'll walk you through each one, clearly, calmly, and with real stories that hit home. So if you're over 60, drop a 1 in the comments. If not, type 0 and stay with me, because someone you love might need this knowledge more than you know. Now, let's begin with a test almost everyone's familiar with, and almost no one questions. The contrast trap. CT scans. You know that warm, flushed feeling that spreads through your body when they inject that contrast dye before a CT scan? That's not just harmless color juice. That's your body reacting to something much deeper. Doctors use contrast dye to light up your blood vessels, organs, and tissues. It helps them see better. But for someone over 60, especially if you have high blood pressure, heart issues, or kidney problems, that dye could do more than just brighten an image. It can put major stress on your cardiovascular system. Here's how. In some cases, the dye causes a sudden drop in blood pressure and heart rate, a reaction called a vasovagal episode. You might feel dizzy, faint, even black out for a moment. But in other cases, it does the opposite. Blood pressure spikes sharply, fragile arteries constrict, and in that sudden pressure surge, a stroke can quietly begin. Still skeptical? A peer-reviewed study in the Journal of Vascular and Interventional Radiology tracked older adults who had contrast-enhanced CT scans. Within 72 hours, many experienced vascular complications, especially those with a history of hypertension, cardiovascular disease, or kidney issues. Real story, Mr. Howard's wake-up call. Howard was 81, fit, sharp, still drove himself around town. He had some minor digestive discomfort, so his doctor ordered a CT scan with contrast, just to be thorough. The results? Normal. 2 days later, he collapsed in his kitchen. The ER confirmed a minor stroke. Doctors believe the contrast injection may have caused a blood pressure spike that led to a clot forming. Howard survived, but he walks with a cane now, and he wishes someone had told him what to ask before the scan. Protect yourself. Ask the right questions. So, what should you do? Before saying yes to a contrast CT scan, ask your doctor, is this absolutely necessary or just routine? Tell them your full history, especially if you have high blood pressure, heart issues, or kidney problems. Ask, can we do this without contrast? Often, the answer is yes. Sometimes a non-contrast CT or even an ultrasound provides enough detail without the chemical stress. It's not about refusing care, it's about choosing the right kind of care for your unique body. 2. The silent strain, stress tests. Let's move to the next one, the stress test. Sounds simple, right? Walk on a treadmill, wear a monitor, let the doctors see how your heart reacts. But if you're over 60, and especially if you've got high blood pressure or a heart condition, this simple test could be setting off alarms inside your body. During a stress test, your heart rate spikes, blood pressure rises, muscles tighten, your cardiovascular system gets pushed hard. For a 30-year-old, no big deal. For someone in their 70s, it's like asking a frayed wire to carry a sudden electrical surge. The real risk. A 2020 study in the American Journal of Cardiology followed over 1,300 seniors. Nearly 7% experienced adverse events. dangerous spikes in blood pressure, irregular heart rhythms, and even vessel ruptures in the brain. And then there's Margaret, a 74-year-old woman from Ohio. Her doctor scheduled a treadmill stress test just to be safe. Halfway through, she felt dizzy, tightness in her chest. They stopped immediately. The next day, she had a minor stroke. Was it the test itself? Not directly, but the physical strain pushed her fragile system past the tipping point. How to protect yourself. If you're not feeling symptoms like chest pain, shortness of breath, or fatigue, ask your doctor, do I really need this test right now? There are safer alternatives. For older adults, a nuclear stress test, which uses medication instead of exercise, a resting echocardiogram. Your body isn't a lab rat. It's a system. One push too far can undo years of good habits. 3. The sedation trap. Endoscopies and colonoscopies. By now you're starting to realize routine doesn't always mean safe. Let's talk about something your doctor might have casually recommended, an endoscopy or colonoscopy. If you're over 60, chances are someone's already told you it's just a good precaution, especially if you've hit that 5-year or 10-year mark. And yes, sometimes these procedures save lives, but here's what they don't always tell you. The moment you're sedated, your blood pressure drops, your heart rate slows, circulation changes. Now, imagine that happening while you're on blood thinners like aspirin, warfarin, or Plavix. It's not just a sleepy nap, it's a perfect storm. The hidden danger. A 2021 study in gastrointestinal endoscopy revealed that seniors sedated for endoscopic procedures had a notable increase in mini-strokes, transient ischemic attacks, within 72 hours. These weren't full strokes, but they were the warning signs: slurred speech, disorientation, loss of balance, the body whispering that something isn't right. A real moment. Eleanor's story. Eleanor, 76, went in for a routine colonoscopy. No symptoms, just a check-in. She'd been on low-dose aspirin for years. The test went smoothly, or so she thought. 2 days later, she couldn't form words properly. Her hands shook. The ER confirmed a mild stroke. Doctors believed the sedation lowered her blood pressure just enough to allow a clot, held in check by aspirin, to travel and block a vessel in her brain. She survived, but now lives with slurred speech and daily therapy. What you can do: ask why. If your doctor suggests an endoscopy or colonoscopy, say, what's the specific concern? Do I have symptoms, or is this just routine? Speak up about your meds. Always remind them if you're on blood thinners. Ask about alternatives. Can this be done without sedation, or can we delay this until symptoms appear? You're not being difficult. You're being wise. And wise decisions save lives. 4. MRI with contrast. A kidney's blind spot. MRIs are incredibly useful. They can detect tumors, nerve damage, joint issues, the works. But when contrast dye is added, that's when seniors should start asking questions. The contrast used in MRIs often contains gadolinium, a heavy metal. It's supposed to flush out through your kidneys. But here's the problem. After 60, even if your kidneys seem fine, their function slows down naturally. And if you have undiagnosed kidney issues, gadolinium can linger in your body. The fallout. Some studies show that retained gadolinium can damage skin and tissue, led to nephrogenic systemic fibrosis, a rare but painful condition, and perhaps most troubling, accumulate in brain tissue. In a 2019 study, nearly 5% of seniors experienced stroke-like symptoms after MRI contrast, even though they had no prior kidney disease diagnosis. That's not paranoia. That's proof we're missing red flags. Harold's wake-up call. Harold, 79, had back pain. His doctor ordered an MRI with contrast. No big deal, right? 2 days later, he felt foggy. Couldn't remember where he'd parked his car and had tremors in his hands. Turns out Harold had stage 3 kidney disease. But no one checked before injecting the contrast. What to do? Ask. Can we do this MRI without contrast? Request a GFR test to check your kidney function before any contrast is used, and if something feels off afterward, speak up. Even mild symptoms deserve attention. 5. The scan that starts unneeded surgeries, carotid ultrasounds. This one's tricky, because on the surface, carotid ultrasounds seem like the safest test around. No dye, no sedation, no loud machines. Just a quick scan of the arteries in your neck. Sounds harmless, right? But here's the thing. If you have no symptoms, no dizziness, no numbness, no blurred vision, this test might lead to unnecessary surgery. The slippery slope doctors see a 50% or 60% narrowing of the artery. Suddenly, you're sent to a vascular surgeon, and now you're being prepped for a carotid endarterectomy, a major procedure that comes with its own risks. One of those risks? Stroke during the procedure. A huge study in the New England Journal of Medicine found that surgery didn't significantly improve outcomes for seniors with moderate artery narrowing compared to medication and lifestyle changes. Helen's story. When too safe became dangerous. Helen, 82, was healthy. Her doctor ordered a carotid ultrasound just to be safe. It showed 65% narrowing. She was rushed into surgery. During the operation, she suffered a stroke. She survived, but her right side remains weak. I wish someone had told me that doing nothing might have been safer, she said. What you should ask, what are we looking for? Will this scan change my treatment plan or just create worry? Is this surgery essential or just preventive? Sometimes, the smartest thing to do is nothing. Be your own VIP. Let's wrap this up with one simple truth. You are the VIP of your health. Not every scan is bad, not every test is dangerous, but not every test is necessary either. As we age, our bodies change. What worked at 40 might be risky at 70, and what sounds harmless, contrast dye, sedation, a treadmill, can tip the balance in an aging system. You have the right to ask questions. You have the power to request alternatives. You have the wisdom to pause and say, let's think this through. Don't just be a patient. Be a protector. Your story isn't written by machines or charts or routines. It's written by choices. And the next time a nurse says, we just need to run one more quick test, pause, breathe, and ask, do I need this? Or does someone need me to say yes? Protect your body. Protect your peace. Protect your story. Share your experience in the comments. Tag someone over 60 who needs to hear this. And hit subscribe to Life Cure Daily, where truth comes before protocol. We'll keep asking the hard questions, so you don't have to face the hard consequences.